by Dr. Matthew Walsh, Head of General Surgery at Cleveland Clinic. How are you?
I'm great. Great to be here.
And how's the show going for you so far?
It's going fantastic. It's a great way to collaborate with colleagues from across the world.
And so tell us about Arab Health and how important it is for Cleveland Clinic.
So it's a great way for us to advance educational opportunities and to discuss common diseases that are different from one region of the world to the next. Today we were having a great discussion about colon cancer, for instance, which is much more common at a younger age in the Arab world and even in the United States. And we talked a lot about screening and ways to try and diagnose that earlier.
And you've been involved in some panel discussions and debates whilst you've been here. Tell us about those.
So today so far has been on surgical oncology, or the surgical treatment of cancer patients. And we're really trying to promote group discussion among surgeons and medical oncologists and radiation therapists, as well as getting patients ready for surgery, then doing the best surgery possible, and sort of monitoring their outcomes so you can get the best treatment for the patients. So again, sharing experience is what's so vital.
And tell us about the innovative robotics that you're working with at the moment.
So robotics is a way to do computerized surgery. It's a way to put together a technique which is sort of enhanced surgery for very complicated procedures. That's how it started. As the technology develops, I think there's going to be more platforms, more different types of robots out there that can be more cheaply dispersed in the surgical community. And the cool thing in the future is going to be how you use artificial intelligence on top of robotics so that you can use data, say, on a digital platform like an MRI, tie that into the computer and help that guide you to take out a patient's tumor.
And how have you seen the healthcare industry evolve in the Middle East, particularly recently?
Well, speaking of robotics, there's been quite a proliferation in the Middle East with robotics. There's also been a proliferation around all of transplantation, which didn't happen before a decade ago. So I love to see everything that comes to fruition. In any way we can help it as a healthcare system, we're happy to do.